On this episode of the NDA Review, we're speaking to the Cabinet Secretary, Ministry of Health, Deborah Barasa Mulongo, who joins us on set. And let's speak just about the 2024 and what it has been like for the Ministry of Health. She's been in the ministry for some months now, but then again, government is continuous, Waziri, and therefore you'll be able to tell us what the ministry has been able to achieve in the year 2024.
Absolutely, absolutely. And the ministry has been able to make significant strides this year in advancing the Kenya's healthcare agenda in line with this SDG, that is Sustainable Development Goal 3, the Vision 2030, as well as the Kenya Health Policy 2014-2030. The critical component that we're looking at this year was universal health coverage. Now, for the universal health coverage, a lot has been achieved. First of all, we were able to transition from NHIF to the Social Health Social Health Authority, and all this is inclusive of what we call Taifa Care, which is universal health coverage. Really, we've been able to register quite a number of Kenyans. Previously, under NHIF, we only had 9 million. Right now, we're at 16.6, almost at 17 million Kenyans. So over and beyond, we're having numbers increase in terms of health insurance coverage. We have increase in the geographical distribution. We have increase in healthcare facility. We have increase in health service delivery. The benefit package, again, we are really tweaking it for the benefit of Kenyans. And again, we are having quality services, among others. Equally, under Taifa Care, we have the community health promoters. We've been able to have 107,000 community health promoters on board, and we recently even give them their stipend. They've been able to cover most parts of Kenya with more than 8.5 million Kenyans undergoing, assessment for diabetes, hypertension, receiving health education on prevention, promotion, management, identifying cases in the community and sending them to facility, and again, supporting in registration under the Social Health Authority. We've been able again to look at the primary care networks. We had none that was established. We have now 206 out of the 315, and gradually we want to improve the primary healthcare networks. And through this, we'll be able to work on the referral system and have improved capacity. You know, primary healthcare is the first contact for patients. By improving this, then we'll be able to have 80% of patients having accessible healthcare before being moved up to the other higher levels of care. We've also looked at the payment, where we've had over 12.9 billion shillings, accrued or collected under Social Health Authority, and then we've been able to pay 5.6 billion. That includes Linda Mama, it includes the claims and the NHIF bill. So there's a lot in terms of improving resources, and gradually we're seeing that affordable, accessible healthcare under Taifa Care is really becoming a tangible reality in Kenya. But apart from that, other infectious diseases like malaria, we are now seeing a lower prevalence, and we hope that we'll be able to eradicate like our neighbors in Egypt. We are also seeing TB, again, which is, again, has drastically reduced, as well as HIV infection, where we've identified some key populations and certain age groups, but we are really working towards having ending AIDS by 2030. So again, a lot has been done in the Ministry of Health to improve healthcare service delivery. And when we talk about matters human resource for health, we see that a presidential task force was established. We see we're working on the human resource for health policy, which is going on its final, reviews. And then we are again been able to deploy human resources for health across, the country, and again at national level. When we look at the health products and technology, we are seeing that we've been able to, recapitalize KEMSA. It was previously 36%. Now we are at 61%. So again, we're having essential medicines, and now it's all about them reaching to the last mile where the patient is. So great progress in the Ministry of Health.
So let's pick it up from the Social Health Authority, because you've referenced it as part of the achievements by the Ministry of Health. But since rollout in October, I'm sure you've received feedback regarding how it's faring. But the big question in the minds of Kenyans this festive season is, how are you addressing the challenges that there's part of the challenges that we've been able to receive as feedback from the members of the public?
Yes, yes. So key highlight, we are less than 100 days old. SHA is less than 100 days old. And it has really an ambitious target. That is the whole nation to, first of all, improve access to care throughout the nation, affordability and quality. And again, digitization of the system. I want 100% digitization of the system in all healthcare facilities. So quite ambitious, but yet again, has been achievable in various countries. So I believe even as Kenya, we can be a best practice, not only in Africa, but globally. Now we are one of the best practices when it comes to digital health globally, not only in Africa. And we were actually able to host one of the global digital health conferences and share our best practices. So what are we saying? We're saying that, yes, we've had challenges, we are engaging, we're having feedbacks from the private facilities, from RUFA, from, stakeholders, the religious leaders and other stakeholders, county level, national level, etc. Because this is for all of us. This is not just for an individual. We are saying we're leaving no one behind. So yes, there have been challenges. We are working on them. When we had started, the public awareness was not quite much, but gradually we're improving in that. And what we are saying is community awareness is not a one-off. Community engagement is not a one-off. It may take a year or two for people to grasp the concept. Engaging with various countries, I've come to realize that it takes people to understand the testimonies, engaging the Nyumba Kumi, the Barasas, the community health promoters, the Ngaos, having testimonies. I delivered via cesarean section under SHA. I underwent an operation under SHA, etc. So engaging that. But what I really want to tell Kenyans, yes, we've had over 500,000 Kenyans in less than 100 days accessing these very services that we're offering under Social Health Authority. But only a few, like when we look at the critical care, we've had, yes, challenges, but there are a few out of the 500,000. So again, let us look at the positive part of it, that other people are benefiting. In fact, a high proportion of Kenyans, more than 96% of the people, that is out of the 500,000 that have accessed care, have benefited. And the critical care component was a challenge. So we are looking again we are reviewing the benefit package, seeing how we can improve the benefit package for the critical care and other concerns that they've raised, like the oncology group, etc. And we are saying that it is a people-centric approach. We are engaging with support groups, patients who are renal patients, cancer patients, the community, to understand what are the challenges, because it's for all of us and we're leaving no one behind.
You reference CHPs, and of course is the model of what is being called access for healthcare by rural and informal settlement areas. But see, as you've heard of the challenges that CHPs are facing, particularly on the matter of emoluments, how is your ministry sorting out that?
The emolument indeed has been a challenge, and I acknowledge that, I take note of that, and what we are doing is to ensure that there's routine release of their money or their monument to the last mile. So yes, it has been a challenge. We are working on it as a ministry together with Treasury to highlight the priority areas where we need resources to be released. Just like you and I need our salaries released at the end of the month, we cannot ignore our community health promoters. So it's a priority thing. We have engaged Treasury so that we have routine release of their stipends, and that way we'll have motivation and they'll be able to serve the community. Yes.
Are they the only people you're relying on really for access by rural and informal settlement areas to healthcare?
They are a critical pillar. They are a marvelous pillar because they are part of the community. They understand the people, they understand the dynamics, the socioeconomic components, they understand the prevalence of even the infections and where they are, So they will be able to support us in terms of reaching the last mile, articulating the concerns of the people, and again, educating the people in matters health, whether it's maternity, whether it's emerging or re-emerging infectious diseases, and also SHA, which they've really supported even in registration. So they are instrumental in terms of pushing health within the community. And we really acknowledge the great work that they're doing.
Great work being done by CHPs, but you also have a critical sector called the health workers. And I'm sure in between this week and last week, you've had some grumbling from a section of them. And indeed, it's what has dominated this year, really, in terms of a strike or, a go-slow or industrial threats of industrial action. What is that compact plan that you have as a ministry to deal with these things so that they don't inhibit service delivery in the new year?
Yes. So currently we are engaging the union for the emergency component, which is the first aid, to patch things up and ensure that we avert a strike. But again, we need to look at sustainable solutions within our fiscal space. And those are the kind of discussions we are having with them. I believe that with the engagements that we are having and being candid and also accommodating them, I believe and we are optimistic that we'll be able to come up with a solution. But yet again, we need to understand that this is the bigger component, the human resource for health, the healthcare workers. And again, we need to address their issues, whether it's mental health and other wellness, whether it's infrastructure, whether it's career growth, among others. So those are the discussions we are having. We've developed a human resource for health policy. We have had a presidential, task force being established for human resource for health, and they have come up with solutions for interns and for other human resource for health, so that we are not having, disruptions when it comes to essential services within the health ministry.
You've talked about the ambitious plans you have regarding the reduction of infections, particularly for TB, and ensuring there is no malaria infections, particularly in the country, just like you mentioned in Egypt. But what are these measures that you're applying to ensure that you get these targets? So
we've done a lot in matters of malaria. We've had increased distribution of insecticide-treated nests. We've had indoor residual spraying in endemic areas, introduction of malaria vaccines for children. I was happy to be in Kakamega and seeing that children are actually getting vaccinated. And then there's piloted innovative seasonal malaria chemo prevention, which has been started in Turkana, and we hope it will be rolled out in other areas, endemic areas. So there's a lot, and that has led to a significant decline in the prevalence of malaria in high burden regions. Yet again, we are borrowing a leaf or two best practices from countries that have been able to eradicate, like Egypt, and really strengthening these areas. But again, we look at TB, where screening has improved, case identification, screening, diagnosis, treatment, and then identification of multi-drug resistant TB. We've had machines like gene experts in the country, and we are leveraging on that even for other infectious disease outbreaks within our country. So we are working again towards improved diagnosis and prevention practices within the community, raising awareness, reducing stigma, etc. So a lot is being done, and when you look at our performance contract, we are really progressing well towards the reduction.
Maternal and child health outcomes. How is the ministry improving that?
Yes, maternal and health is really critical, and we've seen that it's really central in the Kenya Vision 2030. And what we are doing is, first of all, utilizing community health promoters, identifying mothers, encouraging them to visit the clinics. At the primary healthcare level, we have free services when it comes to antenatal and postnatal care. So again, we're encouraging that. And when even you move to the level 3, up to level 3 and selected level 4 facility, then delivery, from level 2 to selected level 4s, you find delivery is again free of charge. And in higher levels, under the Linda Mama, where the country, if a mother is unable to pay, then we are able to pay her premium. So we are not only able to support her, as Linda Mama would have supported her only during delivery, but we're looking at the whole family. The premiums are used to pay for the whole family. So the mother is covered, the baby is covered, her siblings, the baby's siblings are covered, her husband is also covered. And so it is a universal health coverage where the whole household is covered for any matters health. So we are looking at that, educating on family planning, importance of breastfeeding, importance of immunization for children, among others within.
Since we have another public health tragedy unfolding, and that is mental health. And you've seen the number of incidents recorded almost every year of depression or people who've really committed suicide out of this problem that is called mental health. What is your ministry doing to deal with this problem?
Okay, so we prioritize mental health really as a ministry, and it's really part of the commitment of SDG 3 and the Kenya Health Policy 2014-2030. And the key initiatives include the development and the launch of the Kenya Mental Health Policy and the Suicide Prevention Strategy. Again, the ministry is also creating public awareness. You can see we are really engaging a lot with the Madare Hospital and other mental institutions, strengthening, the mental health clinics to ensure that we have them across the country so that they're accessible to all. And under SHA, for once, NHIF did not have mental health as part of their cover, but now we are having it as part of our cover. And we've been able to, Kenyans have been able to utilize more than 104 million Kenya shillings to access mental health care. So indeed, it's a challenge, but we are addressing it exhaustively. We are integrating mental health services within the mainstream of health care service, and we are engaging the psychiatrists, the psychologists, and psychotherapists, among others, to see how do we improve.
Just about 3 weeks ago, President William Ruto said there was an agreement between the national government and the county governments to release 2 billion shillings owed to KEMSA to allow for supply of drugs to health facilities. You can tell us the progress of that conversation, and most importantly, how do we avoid this problem of accruing debt to KEMSA, which effectively affects drug supply to health facilities?
Yeah, that's a brilliant question, really. So we've had, it was at 36%, the order refill rate, but now we've improved it to 61% following the presidential directives. So now we are optimistic, and additional money will be disbursed following, again, a presidential directive. His Excellency, the President, as you can see, there's a lot of passion in terms of improving the quality of health to all Kenyans, leaving no one behind. And so once we've improved the recapitalization in KEMSA, then we'll be able to have good supplies, and our healthcare facilities will be able to access those supplies. Now, under the FIF Act, with the Facility Improvement Fund, what we see is that the more patients a facility will see, then they will be able to send the claims to KEMSA, to send the claims to SHA. Part of it part of the money will also be used to bring more medicines down to facility level. So there's really a lot of emphasis in terms of improving medications at facility level, because part of it is access to essential medicines for Kenya. So we are engaging with the governors to really encourage them again to pay the debt, and again looking at mechanisms where part of the FIF funds is being utilized to improve the essential medicines within.
That's largely about what 2024 has been like. Let's talk about 2025 and what your projections really are. What is your vision for the ministry in the year 2025?
Yes, the greatest component we really need as a ministry is to prioritize accelerating the implementation of UHC. So right now we are less than 100 days, but really you'll see there's a lot of focus on UHC. UHC is really Ministry of Health, it encompasses everything. And again, what we are looking at is how do we plug in and integrate even partners, stakeholders, partners, so that we all have one vision, that is Taifa Care. So we are having one plan, one M&D, one budget, all partners, having a similar goal, and the priority being Taifa Care, that is affordable, accessible, quality of care to all Kenyans, even as they work in their various programs, whether it's TB, HIV, and malaria. And that way, you know, when we synergize, when we bring our resources in one pool, then we are all accountable, we are all transparent, and, you know, there's really great momentum in terms of success in the implementation and the success of Taifa Care. So we are working on that. Again, strengthening the additional primary health care, improving the human resource for health, implementing the policies into strategies, interventions with clear work plans and timelines. Again, looking at HPTs, how do we improve local manufacturing? How do we improve vaccine accessibility and not be over-dependent, you know, on imports? We learned a lot from COVID-19, where, you know, at one time, countries were only prioritizing their citizens. And then, you know, Africa, Kenya included, suffered a great deal. And so we need to see how do we become self-reliant, self-sufficient. And those are the discussions, deliberations we are having.
As the leader of this ministry, how would you want the public to support your ministry in terms of the goals that you've set for yourselves? I'm sure you've even signed performance contracts for you and your team. So how would you want members of the public to support you?
Yes, so critical to that is the implementation and the success of Taifa Care. Success of Taifa Care is success for Kenyans. It is not for an individual, and I believe that is one thing that Kenyans need to understand, that we are leaving no one behind. Anytime, any of us can lose their jobs. Anytime, you know, we have needy and vulnerable people. I always say there's maybe a man in the Mjengo, and he falls from second floor and he sustains fractures, you know. He receives 500 shillings per day. But you see, he has been dependent on that 500 shillings every day. But once he sustains fracture on his legs, now he's bedridden and he's vulnerable. He needs that operation. But maybe he doesn't have resources. So many people undergo catastrophic expenditure. They sell a lot of their resources in order to access health. But when we have a health system that is working for all of us, yeah, then we can move forward. So what I would tell Kenyans, let us be optimistic. Let us share the good testimonies. And if there are challenges, share with us, give us big feedback, and then we can move closer towards having affordable, accessible, quality care, because we all...
Thank you, Waziri. Asante sana. And we thank you for your time. We wish you all the very best in achieving what you've set yourself for 2025.
Thank you. And maybe before I finish, what I'd like to tell Kenyans, we are working together. We are consulting, we are collaborating with various stakeholders, including yourselves, in order for us to achieve Taifa Care, which is affordable, accessible, quality. And our priority is to have 100% health insurance coverage for all Kenyans. Again, we are looking at a digital platform. And for the digital platform, we want that there's a digitalization across all the healthcare facilities and the healthcare system. Why is that? So that there's efficiency and it's effective, there's transparency, there's visibility. We are fighting corruption even at the Ministry of Health. Again, we're looking at essential medicines. We understand, we acknowledge that there have been challenges, but we are working towards 100% essential medicine to the last mile, and looking at the issues of human resource for health to ensure that there's quality again of services in Kenya. So what we want to tell Kenyans, let us work towards this. And what I'm telling you, please let us register. Kenyans, let us register, let us contribute. And for healthcare facilities, please contract, please serve Kenyans under the Social Health Authority. For the healthcare workers, let us strive to having quality services for all Kenyans. For our political elites, be advocates, be champions of Taifa Care. What we are saying for other ministries, we are saying support us again in this noble cause, like the Ministry of Education, to onboard more children, Ministry of ICT, the Ministry of, the other ministries like Communication and ICT to support us in the various components. And again, we are saying to partners, developing and implementing partners. You've supported us a great deal, but we need you again to support us in this, noble cause, and that includes one plan, one M&D, one budget, so that we can really catalyze and have a success in the Taifa Care. And so Taifa Care, afya letu, jukumu letu, tujisajilishe. Na tunasema Ministry of Health, we are leaving no one behind.
2025, clearly you have your work cut out, and we wish you all the very best. We'll be speaking to the Cabinet Secretary, Ministry of Health, Dr. Deborah Mulongo Barasa, who was with us, and of course really speaking about what 2024 has been like for the ministry, but most importantly, what 2025 will look like for you and them, because they're serving you. Thank you very much.